have a question, please use the Q&A function at the bottom. The way that we'll run this panel today is that the first 45 minutes will be a Q&A with our panelists, and then for the last 15 minutes, we will open it up for any questions that the audience members might have. So it is my great honor, again, to present to you our second panel. I'm going to go ahead and read some brief bios to introduce you to all of our panelists today on the challenges of becoming a mother in the time of coronavirus. I'm going to start with Dr. Aurelie Athan. Aurelie Athan is a clinical psychologist specializing in maternal and reproductive health and a professor at Teachers College, Columbia University, where she created the first graduate level courses and certificate program in these subjects. Dr. Athan's research and practice focus on evolving diagnostic approaches in mental health to include strength-based models that are more holistic and empowering. She introduced the developmental term matrescence, which we are very excited to hear about today, like adolescence, to normalize the transition to motherhood. And sorry about that, to normalize the transition to motherhood and highlight its potential for both risk and resilience. Her newest emerging theory, reproductive identity, will debut in the forthcoming spring issue of The American Psychologist. We are also joined today by Jancee Dunn. She is the author of How Not to Hate Your Husband After Kids, which has been published in 12 languages, and I have to say is one of my favorite books in the world. She writes about family and relationships for the New York Times, Parents, Vogue, and other publications. She lives in Brooklyn with her husband and daughter. We are also joined by Dr. Caitlin Fiss. She's a clinical instructor in the Department of Obstetrics, Gynecology, and Reproductive Science of the Mount Sinai Medical Center, and is a founding partner of Carnegie Hill OBGYN in New York City. She has over 20 years of experience guiding women through preconception, counseling, pregnancy, delivery, and postpartum. Dr. Fiss also founded Ready to Parent New York City, a lecture series and supportive community for expecting parents. She is a diplomat at the American College of OBGYN and has served on the board of directors of Physicians for Reproductive Health since 2018. And last but not least, one of the Motherhood Center's very own, Meredith Carlisle. She is a licensed clinical social worker with a master's degree from Columbia University. Meredith trained in trauma-informed cognitive behavioral therapy and dialectical behavioral therapy, and has practiced in residential day treatment and outpatient settings. In the aftermath of the Sandy Hook tragedy, Meredith provided volunteer mental health services at Newtown Youth and Family Services in Connecticut. Meredith earned her Bachelor of Arts from Ithaca College. She is a member of the National Association of Social Workers, Postpartum Support International, and 0 to 3. It is such a great privilege to introduce to you these very esteemed panelists today. And what's really so timely, again, for those of you who are just joining, we are celebrating World Maternal Mental Health Day today. I just want to reiterate, we had over 700 people register for this event. And if that doesn't tell you how important maternal mental health is right now, I don't know what does. So welcome again to all of you. And what is also particularly important about paying attention to maternal mental health right now is that so many more new and expecting mothers and mothers in general are struggling just with the challenges and the transitions to motherhood, and then you put a pandemic on top of it. And this is a really, it's uncharted territory. It's really difficult to navigate. And so we're so happy to have all of you here with us today to help us make a little bit more sense of how to get to the other side of this pandemic, and are really interested in hearing about anything that you can share with us regarding tips and other things. And what I would like to do to kick us off is ask one of my favorite questions to Dr. Athan. What does the term matrescence mean?
Okay, I'm unmuted. Thank you, Paige, and thank you, Catherine, background. Thanks for having us here today. It's wonderful to be here. So I had to write down some notes because as an educator, I want to get this right, given all the ears here. So the way I would define it would be that it is the developmental transition to motherhood, and I'm going to emphasize developmental. So like you said, think matrescence like adolescence, and that word should really evoke adjustment and adaptation, positive growth and resilience, along with risk and potential for setbacks. So I want you to think about that. Before the term adolescence was coined, psychologists had kind of similar questions about, the major growth spurts that were happening and the challenges that children were having on the way to adulthood. So I think you can similarly apply that lens here. Typically, you know, as clinicians, we like to use the gold standard of a biopsychosocial model. I'm going to add spiritual and political as well to that. So things like, you know, brain hormone and body changes, which you've been talking about, questions of personal identity, like who am I, shifting friendships and relationships, concern about your social and professional status, and deeper questions like what is the meaning and purpose of life? How do I want to contribute? And awakening to things like social injustice and political action. So when you have a developmental transition, we're talking about a major life transition, a turning point, a holistic change, not just in one domain, but in all the domains and how they're all interconnected. So I wanted to propose this for you all as an addition, a complement, if not an alternative to diagnostic clinical language, which I know we are here today to do that important work as well. But to sort of also understand that we might sometimes automatically marry distress with dysfunction during the transition. And I knew that in a way, what would be, you know, we're trained in a way, right, to understand what are the diagnostic criteria, but as someone who wanted to understand the normative developmental transition, to understand that so I can understand the other, the fine line, and vice versa, we were really critically lacking models and words. And so a mentor once told me that words create worlds. And so that's really what I hope to give that. And this is obviously Dana Raphael's work, a medical anthropologist who did rites of passage and really saw it through that lens. So I'll stop there. I hope that was helpful.
Super helpful. And Dr. Athan, I just want you to know that your work is so profound at the Motherhood Center, and perhaps Meredith can speak to this a little bit later. I mean, we live by the concept of matrescence, and I think it gives women such a sigh of relief and a sense of relief when you're able to provide a label or a phrase or a concept that describes the birth of a mother, what it is to become a mother. And when we can make that parallel to adolescence, right? All of the physical and emotional changes that are going on I'm watching it happen with both of my children right now. It's like, it makes so much sense, right? That of course these transitions, both physical and emotional, would be going on in the body and the mind of a woman.
Agreed. Well, you're making me smile. And, you know, absolutely. If there's something that is a frame, an explanatory framework. So yes, I'm a clinician, I have an active practice, but really I thought the work was in theory and development and words and development around that, because we lack language, we lack models for female lifespan development. So delighted.
We really appreciate your work. I'm going to jump over to you, Jancee. Thank you so much for joining us today. You've written many best-selling books, as I mentioned in your bio, my favorite being How Not to Hate Your Husband After Kids. I bought it when it was a hard copy, and full disclosure, I tell people I did remove the label off of it because I was reading it on the train.
You get comments. I know I asked them to do like introduction to string theory or something. You could do like a fake cover. They didn't have the budget. Yeah.
Well, it remains one of my favorites. We refer mothers to read that book all the time at the Motherhood Center. What are some of the key lessons and tips that you share in that book that are effective for parents, particularly mothers, to know about?
Well, you know, I visited, among the many couples counselors I visited was Terry Real. He's a counselor out of Boston, and he's notoriously blunt. And I think about a piece of advice that he gave me all the time, which is adhere to full respect living. And it's a very simple rule. It's that nothing you say or do with your partner should drop below the level of simple respect. This is a very high benchmark, and it's very hard. That means no yelling, no name calling, no sarcasm either. You just have to ask yourself, is it respectful? And so I'm not always able to do that, but at least it's simple if you're angry to remember, right? And it is a good rule. Like, why I really was treating Andre, my UPS guy, whom I'm very grateful for, with more respect than my husband, you know, and so I really try to, even now we're all on top of each other, just try to be respectful. And another was that at least our dynamic, and I see this as pretty common, is that I would get offended when he was kind of sitting on the couch and playing social chess, which he likes to do, and I was doing 20 things. And I would fume, and fuming, I realized, was more comfortable for me. It felt safer for me to fume or to hate munch dinner rather than tell him clearly what I wanted, which makes, you have to be somewhat vulnerable, don't you, in order to say, you know, another thing that Terry Real said was to get familiar with the phrase, what I'd love for you to do is. And you think this would be so easy, but it wasn't for me, because it's easier to be angry or to yell, I'm doing everything around here, but it's harder to kind of focus on what you want. So I did that. Another was saying thank you. Paige, I'm just rattling them off, but there's so many.
Jancee, you're killing it. Keep going.
Just keep going. Say thank you. You know, there's University of Georgia research that couples who said thank you regularly to each other, and it need not be for big things. It doesn't need to be like, you know, thank you for impregnating me. It can be like, thank you for bringing me tea. Their marriages were longer and happier. Another one is this is John and Julie Gottman. You know, Dr. Athan, I'm sure, is very familiar with it, and the other people on the panel, but look for the good. And when we're all hunkering down on top of each other, that can be difficult, can't it? You know, but when you don't look for the good in your partner, yet another therapist we went to, he had us do this exercise where my husband Tom and I, we had to write down 15 things that we loved that our partner had done for us. And we weren't supposed to share the list. And then for our next session, we came in with our little list, and we had to read it to each other. We thought we had to read it to Dr. Guy Winch, and he said, no, face each other and read it. And as I was reading it, one of the 15 things was, you painted my parents' house every weekend last summer. I had such tunnel vision, like, you're a slob, you're not helping me, that somehow it had totally blown by me that the guy was on a ladder every weekend in the heat near a wasp's nest, like painting my parents' house. And that's so indicative of what was going on in our marriage. Another is to take 10 minutes every day to talk about anything except logistics, your paper towel supply, and your child or children. And another is non-sexual touching. Again, we're all on top of each other. Maybe you're touched out. Maybe you don't feel like touching anybody. But I really do try to squeeze his shoulder occasionally. You know, sling my legs over his when we work our way through the Netflix queue. You know, things like that really do help. And saying yes, another Dr. Gottman gem. It was, he likened it to having a salt sprinkler, that all of his findings and teachings could be put in this metaphor of a sprinkler. How many times can you sprinkle the word yes throughout your day? And I'm conscious of this too. Like I just said to Tom earlier, yes, quesadillas might be great for lunch. Like it doesn't need to be major, it can be minor. But the little things often have more impact than the bigger things, than the big gestures, than the, you know, the trip that maybe we'll one day all be able to take for your, you know, anniversary. It's the little day-to-day stuff. Shall I go on, or because I could just keep going and the night will fall.
Well, I want you to keep going. I just want to offer a couple of things based on what you said. We talk a lot about this again in treatment at the Motherhood Center, is that anger can be a shield that makes us feel strong, and it protects us from the vulnerable feelings that rest behind it. And so it can be much easier to feel angry than to look at what that anger is protecting. Is it protecting the fact that I have a hard time asking for help, that I feel insecure right now that I can't get this done on my own? And so I appreciate you bringing that up, because I think it's a defense that many of us carry, because it makes us feel stronger. And one of the things that I really took away, and I also like to infuse in treatment with women at the Motherhood Center, is this concept of, you know, I'm type A. I'm sure that probably many of us would put ourselves in that category, not everybody. But I think a lot of times new mothers that fall into the type A category have a very specific way of wanting to get things done, right? Like there's a very specific way to put on a diaper. There's a very specific way to put clothing on, to feed a bottle, to put down to bed. And so what can happen sometimes is when dad or partner tries to get involved in that and takes some of that over and help, mom is saying, no, 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 that's not how you do it. You do it this way. And dad or partner doesn't do it that way. And then mom finds herself frustrated and is like, oh, I'll just do it, right? Because you're not doing it the right way. So then mom starts to take over everything, and in doing so starts to breed more and more resentment towards dad or partner because she feels as though he's not doing anything or enough. And then dad or partner kind of becomes familiar with this concept that, like, well, mom's got it, you know, like she seems to be like killing it over there, and so I guess I'm just going to keep doing this thing over here, to your point, Tom, being on his phone playing a game, right? And so I like to encourage women to really try, and I'm channeling Meredith right now, radically accept the fact that your partner is never going to do everything or most of the things that you do the exact same way that you do. And the more we can start to make room for and tolerate those differences, then the more we become a unit and a partnership, and both people begin to feel effective, even though the way they're accomplishing something might look different. That's one of the wonderful things that I took away from your book. So thank you, Jancee. And we're going to come back with I'm going to come back and get some more great tips from you. I'm going to move over to Dr. Fiss. For those of you who missed Dr. Fiss as an OBGYN, and I just want to say thank you, essential worker who's going to the hospital every single day, delivering babies, and you know, just being there, putting yourself at risk and doing everything you do. So thank you. And I want you to know, I think of you every day at 7 o'clock. So
thank you.
Delivering a baby during coronavirus looks very different than before. Can you describe to pregnant women who might be joining us today what they can expect if delivering in our hospital soon?
Sure. Thank you for having me. I'm honored to be part of this panel. And I came on to help navigate pregnancy in the time of COVID, but I think I got more help just from listening to Jancee, so thank you for that. Pregnancy in the time of COVID looks really different than anything we've ever experienced before. And I kind of break it down into 3 different sections. So one is the pregnancy itself, and it can begin with preconception. Should I be getting pregnant now? What are the risks? And when we go to the studies to seek sound medical advice, I was looking something up this morning, and they're like 7 people in the study. And typically medical studies, a small to medium-sized study might have 1,000 people in it. And these studies, we can look at 7 patients. And these are studies that are coming out over a 4-week period of time, from say January to February 2020, coming out of the experience in China, which is proving to be very different than our experience in the United States. So we start off from the medical community with very limited sound data to guide our patients, which makes us feel uncertain, and then I'm sure makes our patients feel uncertain. What we've been telling people is because it's going to be around for a while, and it's not panning out to have some of the effects that we thought it was going to have, go ahead and get pregnant for the vast majority of people. There are certain people that may have extreme cardiovascular issues or respiratory disease that we may say, wait, this isn't the time for you. But for the vast majority of healthy women seeking pregnancy, because we don't know how long this will be around, we're telling people to go ahead and get pregnant. Then we think about the time of pregnancy. It's for many people just such a joyful time, looking forward to expanding their family, filling a role that they may have looked forward to. It can also be a time of extreme anxiety. And then we're adding on to that another thing that feels scary, which is the unknown of COVID. One thing that we've been pleasantly surprised about is we prepared ourselves for women to have more significant severe complications from COVID based on physiological and hormonal changes in their body and how they respond to other respiratory illnesses. We just thought, okay, women who are pregnant are going to do worse. What we're finding out is that actually they don't do worse, and in some instances they do better. Yes, women who are pregnant can get COVID and they can have significant severe disease, but they're not on the whole doing worse than their non-pregnant counterparts. So there's the pregnancy, and then there's the anticipation of the delivery. And for many pregnant women also, I think there's the complicating factor of I may not have to go into a doctor's office or a hospital, but now that I'm pregnant, I do. And what will that look like? What will that feel like? And I want to assure everybody out there that now that we've had experience for 6 or 7 weeks with this planning and get into place, we feel very confident, and there is some reassurance in knowing how this is going to pan out. Like, we know if we go to, we know how to plan our office hours. We know how to staff our office, how to clean our office. If we wear certain masks, if we wear certain gowns, we're protected, you're protected. So things are falling into place. We figured out how to minimize the number of prenatal visits. What are really the essential visits? When do we need to actually see somebody in person? And we've all gotten comfortable with the telehealth, telemedicine, getting on a call. So we've really been able to sort of put those things in place. And I think that's giving us as providers and you as patients comfort, because there's a way forward. Then then the next stage is the delivery, of course. And that, I think a lot of people have a vision of what that will look like and what that will feel like. And I want to reassure everybody out there that your hospitals and your providers are ready. We now have an experience in many parts of our country. We know how to do this. We've got this. We know how to test partners and patients coming into the hospital. We're now allowing partners who are tested and who are COVID negative to come into the birthing room. In New York State, they've now listened to the WHO advice, and they're now testing doulas and allowing doulas to come into the birthing room. So some of the scary stuff that happened over the last few weeks where partners weren't being allowed in, that's been removed. We recognize that they're a vital part of the birthing experience, and they're there. The nurses, and I was just on labor and delivery yesterday delivering a baby, and I will tell you, the nurses and doctors and housekeeping staff and OR technicians and people that sort of stock the rooms and bring the meals are all singularly focused on patient care in a way I've never experienced before. It's actually beautiful to see. And we are focused on delivering healthy, safe babies and creating healthy, safe families. And we've been able to do it. So we've figured out a path, and we've had very, very few COVID positive babies. Even when the moms are COVID positive, we've been able to help them care for their babies safely, breastfeed their babies, and leave the hospital safely. For people who have tested COVID negative, we've been able to get you into the hospital safely, been able to deliver your baby safely with no changes. I mean, as one of my first time moms said to me in labor, I've never been to the hospital, so I would just assume everybody's wearing a mask all the time. And so the way we're really delivering our care is the same. And it's really kind of beautiful to see everybody focus on a singular goal at once and come together. And it feels very orderly. And so we can deliver care really well. The last thing is the postpartum. And for that, I really feel for my patients and the families. It's meant to be a time of families coming together, and a lot of people, if they have extended family, expect the family to be there. And this is why I think the work that you're doing at the Motherhood Center is amazing, and this conference is so important, because it's a lonely time for anyone going through the process of matrescence, to use Aurelie's word, and to becoming a mother. It can be lonely. It changes your relationship with your partner. It changes your relationship with yourself. You have lack of sleep, you're tired. And to have to do that alone has felt daunting to many people. Again, there are people out there, and we're all trying to adjust to this new telemedicine world. There's Motherhood Center, there are people like you across the country. This is the time to reach out to people. I had a patient who unfortunately had a miscarriage today, and she said, we told our parents. And I thought, that's okay. We're locked in our houses, and it's, you and your partner. It's okay to reach out and lean on your community, even if it's virtually, even if it's by phone or by video.
Thank you for that amazing response, Dr. Fiss. And I think, one of the things about this pandemic is that traditionally, as clinicians in the field of maternal mental health, we know that there are certain risk factors. Those risk factors can be isolation, lack of social support, experiencing high levels of anxiety. And unfortunately, this has become the new normal for a lot of new and expecting parents, which is why we are seeing such an increase in anxiety and depressive symptoms across the board perinatally, which is one of the reasons why we wanted to have this event today. But it's true, there are ways to receive that support out there. So many providers like us have moved our treatment options to virtual, whether it's our day program or it's individual therapy or medication management or support groups that cater to pregnant, postpartum, women that are struggling with sleep. There's mental health treatment is probably more easily accessible right now than it ever has been. So I say that because I really want to encourage everybody to take advantage of it. And what I feel like, Dr. Fiss, and I know we did a webinar a couple of weeks ago when things felt a little, there was so many questions going on, right? There was that period where partners weren't allowed, and then they were, and then doulas were, and then they weren't. But now I feel so confident right now, like, you guys got this. Like, you figured out the way to do this that suggests confidence and mastery, and that ensues confidence. And so I hope for the pregnant women out there that are listening, that they're having that sense of confidence, because it sounds like now more than ever before we've got this figured out, and that the team on L&D and postpartum are treating women with the care and respect, new mothers, more than ever before. So that is wonderful to hear.
Can I just speak to the confidence thing? To speak to what that word confidence that you use. We have confidence, yes, but I've also been finding in the moms who have gone through this is something that we can't look to, to any other time really in history, because everything's so different, right? Even if you go back to, people keep talking about the Spanish flu, but they didn't have cell phones then and video conferencing then. But what I found is the women that I've helped through this period have found a new sense of confidence, because they've had to rely on this inner self and the community that they've built and the resourcefulness, and found that they can, it was 100%. I mean, very few things we can say in medicine 100%, but people have surprised themselves and been able to find an inner strength to carry them through this challenge that I've admired and found surprising, because as I said, there's very few things that are 100% in medicine.
That is wonderful to hear. Meredith Carlisle, TMC's very own, question for you. New and expecting mothers are experiencing so much real and perceived fear right now. What skills and tips can you suggest that women can use for relief?
Thanks, Paige. And I just want to say what an honor it is to be part of this panel with all these amazing women. Thank you for having me. As we've talked about, it's sort of surreal and unprecedented right now. And that's on top of all of the emotions and changes that moms that are new and expecting are experiencing. And so it is overwhelming. I think that first step is really acknowledging and validating that these feelings of fear, of sadness, of grief, and even anger, as Jancee was sort of speaking to, they are really increased during this time, and they're closer to the surface. And so it's really important to recognize that it is overwhelming to be a new or expecting mom during this time. I think we're all grappling with the fact that we really can't control this crisis. We don't have a lot of say about what's happening. That's been clear. And for new and expecting moms, that feeling already exists, this idea of a loss of control that comes with change and transition. So I think reminding ourselves that we don't have control, but that doesn't mean we're powerless is really important, right? An absence of control does not mean we have no say. And that's really, really important to remember during this time, because where we do have say is in how we respond and how we cope with our feelings during this time. So that might look like, intentionally talking with your partner or a family member about the things you miss, or the things that you're scared of, but then also asking yourself, what are my choices right now? What do I have say about? Instead of sort of stopping the story at I can't control, go to the rest of the story, which is what do I have say over? Related to this, we've talked about being New Yorkers, is managing expectations of yourself right now, accepting and managing your expectations of yourself, of your partner, of your children. Living here in New York City, like if there's anything I know doing this work, it's that we have high expectations and high standards. This is the time to right size those without criticism or judgment. Really think about, on purpose, create a list. What do I expect of myself right now? What do I expect of my partner right now? Is that realistic given all that's happening? And really try to do that without judgment, without criticism. Remind yourself you're not failing, you're getting through a really challenging time. And on purpose, to have those conversations out loud with people. Another tip I really talk a lot with moms about is giving space to your feelings and naming them. You know, we really think that coping with our feelings is this idea of pushing them away, not acknowledging them. Paradoxically, that amplifies amplifies them. We know that. And so that can lead to more distress. So really naming them and accepting them. It's a word you guys are going to hear me say a lot. So allowing our feelings to be what they are, it's a really, really important part of coping with them. There's a phrase out there called name it to tame it. It's the idea that accurately labeling your feelings really does begin the brain process of soothing. So for us New Yorkers, like, resist the urge to fix your feelings, to fix them away, resist the urge to react to them, or silver lining them. This is the idea of, when a distressing emotion comes up, we rush right to, yeah, but I'm really lucky right now. Gratitude is an important coping strategy, but we can't shortcut it. If we shortcut to, yeah, but I'm lucky, what we're actually doing is we're pushing those feelings away. We need to do the order correctly. So instead of rushing to the silver lining, we need to acknowledge that this is really hard and scary. And there's many things to be grateful for right now, but we really can't shortcut it. So don't forget to really validate your feelings and accept them. Some practical soothing strategies alongside those other ones is, moms, soothe yourself first. This is a really important concept because it's pretty hard to soothe anybody else or to have conversations with others when you're in a place of distress or dysregulation. So really take the time to soothe yourself first. That can look like prioritizing a regular sleep schedule or eating a balanced diet as much as is possible. I think we're all reaching for the chips and the ice cream right now, but try to keep in mind a balanced diet and foods that help really nourish you. I'm a really big fan of breathing techniques. It's a quick and easy, pull it out of your back pocket, effective way to manage intense emotion. The idea with breathing is you want to make it a paced breathing. So you want to intentionally control your breathing. You can use counting, so counting in for 7 seconds and exhaling for 11 seconds, or one of our favorites at the Motherhood Center is 4-7-8, which is breathe in for 4 seconds, hold for 7, and exhale for 8. The pace doesn't matter, but it's the idea that you're, number one, distracting your thoughts with the counting, and number two, soothing your body. Another one that we talk about a lot at the Motherhood Center is temperature. Using cold water or ice has this incredible effect of really communicating to your brain that you're okay. It literally helps cool you down. It's an effective use when you're having high anxiety or high anger. So grabbing a Ziploc bag of ice or an ice pack from the freezer and putting it on various touch points that get warm in high emotion really helps soothe that part of you that's in the fear place. Another strategy is using your 5 senses as a vehicle to soothe. So that could be creating an album on your phone of vacation pictures that you find really relaxing, listening to music on purpose that you enjoy, smells, so essential oils. I'm a really big fan of citrus. I think in pregnancy it's very soothing for nausea, but also it's quite soothing for those of us that might have allergies during this springtime. So citrus or lavender or vanilla are very effective. Touch, so pet your dog, give your baby a massage, rub your belly if you're pregnant, play music to your belly if you're pregnant. So really thinking about how to use touch in a way that's soothing. And then for taste, really, this is a time to sort of treat yourself with making a special iced coffee now that it's getting warmer out, or mindfully eating and focusing on the flavors and textures. That's the sort of physical aspect of tips, but I think that there's also ways to soothe your thoughts, right? Self-talk or being your own cheerleader or having a partner or family member be that role for you is really important. It might seem simple, but saying to yourself, we will get through this, and you may not believe it 100%, but saying it is still important. This will end, right? We don't know when, but we know that this isn't going to be forever. And reminding yourself, because when we're in it, we really lose perspective. I'm a really big fan of distraction as well. So for those of you that this feels doable, start a book club with friends, plan a fantasy vacation that you may or may not ever take, but really detail, like, where would I go to this far off city or park? What will I do when I'm there? What will it sound like? What do I think I'll see? Trade Netflix comedies. This is one of my own personal favorites. I'm on the prowl for any Netflix comedies or suggestions that friends and family have. So actively trading comedies, right? The point is you're trying to connect with an emotion that's soothing, and laughter really is really effective medicine. Finally, what I'm calling connect and limit, which is this idea of, that's already been talked about a little bit, which is connect to loved ones, family, friends, in ways that feel doable and authentic. So if you're feeling zoomed out, maybe you're gonna call somebody rather than do a video conference, or maybe you're gonna text, but try to find ways that feel doable and manageable to you. But at the same time, right? Limit things that are distressing or draining to you. So this is where we're not necessarily watching the presidential briefing every day or the news all hours of the day in the background. Intentionally limiting social media access when you notice you're zoning out and it's creating a sense of distress. And then finally, with regards to social media, I'm a really big fan of contextualizing and translating. So reminding ourselves that still images are one moment in time in an otherwise difficult day for that person in all likelihood. So we forget that because what we see in front of us is maybe an idealized moment where the bread turned out beautifully, but we didn't see the flour being thrown across the room by the 3-year-old right before, or the way it fell on the floor after. So really remember that it is just a still moment in time, and that there's a lot more to that story.
Meredith, I could listen to you forever, and I see a book in your future. Those are excellent tips. You got a lot of really positive feedback from the audience, so thank you.
Thank you.
I'm going to come back to you, Dr. Athan. Now that we have a better understanding of the concept of matrescence, thank you for that. What new challenges might women face as they become mothers during a pandemic?
Well, thank you for that question. And I have to say, I actually posed it to my class as well. So I think we have a number of students in the audience, and I just want to sort of give them a shout out as we did this sort of as a project-based learning task. And, unfortunately, I would actually say that maybe my first answer would be that not much is new, that actually it's more like deja vu in many ways. I think we know that a lot of the difficulties that were already there just become all the more amplified. And I think it's kind of part of the larger narrative how Corona has shown a lot of cracks in the system in healthcare and beyond. They sort of lay bare the systemic issues, the personal issues, the social disparities. And I would say that the same applies here. So, it's been very revealing. And I think, if anything, we should use it as a lens to make visible the invisible, what was already challenging for the transition to motherhood and beyond, the whole preconception through lifespan, experience is very complex, and it has only become in many ways more complicated, though, as even Dr. Fiss is saying, we also are seeing how the resilience can also become amplified. So if we had to say what was new, many of it has already been said. A lot of the sort of concerns around safety and safe passage around birth, a lot of the delays in fertility treatments and those devastating postponements and disappointments. But if I had to choose what was really unique in this time, yes, there's heightened anxiety, and yes, there is isolation and loneliness, as was what was said is social support is the usual suspect. I mean, that's really the place, that the cornerstone that we have to go to. But I would say it's this sort of existential piece of uncertainty. I think that's the one. So all the things that we know, right, are there. And yes, they become new, like during a time of war or during forced migration or anything like that. But I think this sort of larger uncertainty, as to, the ecological concerns, the sort of larger questions that have come up are things that we're sort of hearing. One of my clients said, we might be sort of like parenting into the abyss. Now, I know that's sort of an abysmal comment, but I think that there are these larger questions about, what will our future look like? And so I think at that macro level, sort of that personal distress kind of marrying with this more transpersonal question of our kind of collective well-being is something that I think is really actually something we can turn to a more empowering thing. I really have always seen mothers as social agents of change. I really see part of what they see, whether it's in the partnership, if one is there, the inequities that are there, or the larger systemic, that it's time to really think creatively about how to make some important shifts, not only personal transitions and priority reorganizations, but really thinking at that kind of larger level. So, I think the thing that also maybe the mourning that might be unsaid right now, but will really come with time, is this loss of the rite of passage. We're really seeing this around the lack of participation in funeral rites and, being there for the death and dying, and not having that sort of intimacy around, the sort of hinges of life, on the way in and on the way out. I think that that's the place where we're really going to see how important that was. We're all seeing how important that is. So I think that's what I would say.
I think the word, and it's funny, I feel like it's a word that I took off the bookshelf and dusted off because it's something that feels old-fashioned, but grief. I feel like we're all experiencing different layers and levels of grief right now, right? And grief around loss of what we thought was going to be, and the grief that you just described, just about the toll that this is having on people's lives. But to make room for that feeling, to acknowledge it, to Meredith's point, and to notice it and allow it to be there. But I think there is quite a lot of grieving in that regard as women enter this transition to motherhood, and it's not what they thought it was going to be. Yeah, thank you for that, Dr. Athan. Jancee, families are having a particularly difficult time doing it all right now. In many instances, one or both parents are working at home while navigating homeschooling and childcare all at the same time. What advice or tips do you have for a couple right now in particular to navigate this situation without killing each other? And I can just say I fall into the category and I'm very interested in your response.
Feelings, I would recommend taking stock of what's working and what isn't working in your household. We're all, I don't want to say trapped, but we're all home together. You can't run away from what's happening. So not to get too sunny, I know it's so difficult for everybody, but this is a prime opportunity to assess what's working and what you can fix in your household systems. I mean, we have a family meeting every Friday. It's so boring, but why not have a meeting? What else are you going to do, right? We get some pizza or something to zhuzh it up, but we sort of discuss what's been going on. I mean, this really, there's so many bad things about this time, but this is a good thing where you have the space and the time to talk about it. And we realized even in our own family, my daughter just turned 11 and she's not contributing to our household as much as she should, that she needs some serious chores. And that was a big, like, why are we doing most of the work? She's perfectly capable. And so that has really helped, because of all the people I interviewed for my book, I mean, I interviewed psychotherapists and neuroscientists and 2 crisis negotiators from the FBI. And they all said the same thing, that conflict arises when things are not clear. So here's your opportunity to make things clear. And, there's been so many cases of that in my own life where, you do the thing where you say, well, I thought you were going to do it. Or you fight over the weekend for who deserves to sleep in more, you know, who worked harder during the week. And like, if you go back and really get granular, I mean, we sat down, the upheaval we had was having a baby. And so we had to sit down per our counselors. We had one counselor who said, I've referred to like 10 counselors we've had, which is kind of true. One said, name one thing that hasn't changed after you have a baby in your life. You have a brand new relationship. So act accordingly and start from the ground up. We sat down and we divvied up our household chores. I mean, another boring, you know, exercise, but it helped so much because we realized, you think you know your partner. My husband, I found out, doesn't like to grocery shop. He doesn't like fluorescent lights in grocery stores. I don't know. I love food, so I took over that. So we started building from the ground up. What can make sure everybody has a clear job, including your child if they're able. And again, with clarity, and this is psychology 101, but you know, the FBI, the FBI crisis negotiator, Gary Nestner, who's become a friend, weirdly, and he said that of his 30 years in the FBI, the most important thing that he learned is that people just want to be heard. And he put down prison riots and, you know, hostage situations and paraphrasing, which is so simple, and it's simply repeating what your partner says in your own words. It indicates that you have heard. You can't fake paraphrasing. And that was the thing that always used to enrage me about my husband, whom I love. But I could see him just repeating my words but not understanding them because he was doing it word for word. But when he had to interpret how I was feeling, it took the wind right out of my sails. And the other thing I would say is what helped us, and I don't know if this is even healthy or not, is that the more you read about behavioral modeling, right, the way that you act has more impact on your children than the way that any high-flown rhetoric that you say. You know, I used to do a lot of, I have a daughter, and I would say, like, girls rule, girls can do anything. What she saw was me doing most of the stuff in all the drudgery in our household. And she would say things like, oh, moms do the boring stuff, men do the fun stuff. And I thought, oh, no. So I showed research to my husband about behavioral modeling, and we started acting. It was like bad community theater where we would resolve our disputes in a healthy way because she was watching. They're always watching, particularly now. And the more we did it, the more it became real and our acting became more convincing. And then we really did start resolving things like grown-ups, and it became our new norm and everybody benefited. So that really helps. And you know, we were so child-centric that our motivation was, I said, Tom, she's forming expectations of what she's going to expect from her guy or gal when she gets older. Do you want her to, you know, be with someone who sits on the couch and plays computer chess all day? He didn't like that. And so that got through to him. And that was my motivation too. It wasn't, sadly, oh, our marriage is heading into the toilet. It was, oh, we're going to ruin our kids. So now we're much more appreciative of each other.
Those are excellent tips. And as you're talking, I have a boy and a girl, and I consider myself to be pretty progressive feminist. And I have to catch myself sometimes when I fall into those gender roles, right? Where I will ask my daughter to do the dishes in the dishwasher, but not my son. I have to be like, why am I doing that? I mean, I was conditioned to be that way, but it is an exercise, right? You do have to think about it and catch yourself. Yes, Meredith, you wanted to add something.
I just want to add to this conversation because I think in the early postpartum, there is an assumption that women know. And so I do think, to your point, it requires sort of explicit conversation about who's going to do what, and not the assumption that because mom birthed the baby, that mom knows exactly or will do all of the things. And so to really make that an explicit conversation is often something we're talking about supporting moms in doing.
That's a great point. There was an article that came out recently in the Times, I believe, that said that there is no scientific evidence to suggest that women have a maternal instinct, which I thought was pretty interesting. Dr. Fiss, I want to come back to you. How can pregnant and postpartum women best protect themselves and their babies from contracting coronavirus right now?
Well, I want to go back to what some of my co-panelists have said and say just speak to what your word, grief. So this is a time that we're grieving, and there is some isolation, and I think that isolation, those are tied in, the grieving and the isolation. So I just wanted to acknowledge what you were saying. But the isolation is really part of the success of preventing COVID. So keeping, you are the ones that have to really adhere to the best practices of social distancing. And I'm a big proponent. I think that we've had a lot of confusing messages in our country about masks. Masks are helpful. Even when moms are breastfeeding babies, we're recommending a mask because it prevents any particles of saliva, if you have to sneeze, if you have to cough, even if you're talking or singing to your baby. Particulate matter can fall on the baby. So masks are helpful for several reasons. They don't 100% prevent COVID. We're not talking about N95 masks or surgical masks either. I'm just talking about any kind of facial protective shield. It can be a scarf, it can be a bandana, anything there does a couple of, one, if you sneeze or cough, it prevents your particles from going out into the open to other people like your baby or anybody else in the community. Two, it prevents you in many cases from touching your face. If you're wearing a mask that doesn't fit or is too uncomfortable and makes you continually adjust it, then that's not the right mask. You should be wearing something that just reminds you, right, I'm not supposed to be opening a door and then touching my face, or going to the supermarket and scratching my nose while I'm waiting in line to pay. So masks can be helpful for many reasons. And also, if somebody walks by you and inadvertently sneezes or coughs, you at least have a first line of protection. And it's not going to be perfect, but you have a first line of protection. So wearing a mask, cleaning things that come into the home, wipe them down with any kind of towel mixed with Clorox bleach, or Clorox wipes are impossible to find. Have any kind of antibacterial wipe anything that comes into your home. Open packages and leave them outside. Many people have said, well, what happens when the crib furniture comes? If you have another space to assemble it in, then wipe it down and then assemble nursery furniture, do that. But really try to be mindful when we're talking about social distancing. It's for you, it's for pregnant women and expecting families. And that means all the families. Like, the pregnant woman can't be home doing everything perfectly and the partner's going out to the market with no mask and not washing hands properly. Hand washing all the time. Really advocate for foaming soap. It really works well. When you come into your home from outside, first thing you do is take off your shoes, go to the sink, wash your hands. And for people that are living at home together, you don't need a mask unless, of course, you're caring for somebody who is COVID positive in your home, and then you need a mask. And I would probably suggest that the pregnant person, if possible, obviously if it's two adults in the home and one is COVID positive, then the pregnant woman may have to care for the COVID positive patient, but hopefully not. Like, hopefully then somebody else can be brought in if that person isn't the direct caretaker. So masks, hand washing, taking off your shoes. If you're out in public and you come home, take off your clothes, put them in a safe place to wash in a garbage bag or something so you can wash them later. Change clothes in the house. Just really adhere to the basic guidelines that we've put forth.
Thank you, Dr. Fiss. I'm cognizant of the fact that we have just a few minutes left. I'm going to ask Meredith one quick question, and then I'm going to get to one question. We just had a few come up. If for some reason I cannot answer the questions that came in, we will get back to every single one of you. I know this is kind of a big question, Meredith, but if you were to abridge the shenanigans out of it, with so much anxiety going on right now with new and expecting moms, what are some ways that a mom might be able to determine the difference between normal and whether or not a PMAD is at play?
Yeah, I appreciate that. It can be hard for me to abridge myself sometimes, so I will do my best. The first is just reiterating how much change is occurring really can complicate it for a mom or for family members to know what is normal or what to expect during this time. So the abridged version is, don't just think that the presence of worry or the presence of symptoms alone is really how we determine it. We really look at the intensity of something like worry, how much? Zero, I'm a big fan of a 0 to 10 scale. So if we're in that 8, 9, 10 region, that's a pretty intense level. So not just whether it's there or not, but how much is there? How often is the second way we look at it. How often is it happening? Is it a few moments here and there? Is it half the day? Is it all day? Is it many days in a row? Can I put it down is another way. A question that we ask is, can I be distracted from the worry, or does the symptom respond to support or help? And also, how much is it getting in the way? Is it getting in the way of me enjoying moments, enjoying parts of this experience? Is it getting in the way of me sleeping, eating? Those are really tangible ways, not just whether or not you're experiencing something, but a little bit more three-dimensional of a version. But ultimately, we're not expecting moms or partners or family members to be the experts. And so, contacting a professional who is really trained to help tease this out for you, and to support moms in knowing where they fall in that range is my recommendation. I just want to say, this is not the time to white knuckle it. This is the time to reach out for support. You don't have to feel this way. It's not your fault, and you really can feel better. So.
Thank you, Meredith. And it is that easy. And you can call us at the Motherhood Center. We have skilled care coordinators that answer every single call in person, who can really start the process going on determining whether or not you are struggling from a PMAD or you're having normal symptoms. But yes, Meredith, I support what you're saying 100%. All we have to do is ask. All we have to do is speak to a mental health professional to find out. And with just one question from the audience, Caitlin, this is really directed to you. I have a staff of community health workers who support pregnant and postpartum moms, and they are not sure if they should be encouraging their moms to breastfeed if they're COVID-19 positive. Is breastfeeding putting the infant at risk?
That's a great question. Yes. Yes to everything. Yes, there is slightly increased risk because of the proximity that you have with your baby, but we really are encouraging people to breastfeed even if they're COVID positive. You're passing antibodies to the baby. You're giving the baby the best nutrient there is there, and you're giving babies antibodies to COVID, but also helping to build their immune system on many other illnesses and things that you've been exposed to. So we definitely do encourage people to breastfeed, and that may look different. It may mean that you're wearing a mask, as I was just saying a few minutes ago, because when you're in such close proximity to your baby, you don't want droplets to go onto the baby. It means washing your hands before and after you're touching the baby, but we do encourage it.
Well, I could sit here speaking to you all for another 5 hours. I cannot thank you enough for taking time out of your day to help us celebrate World Maternal Mental Health Awareness Day and share all of your insightful information, ideas, and tips to help new and expecting mothers make it through this very difficult and challenging time. We are going to start to transfer the reins over to Dr. Berndorf, but Jancee, Dr. Athan, Meredith, and Dr. Fiss, I cannot thank you enough for being a part of this today. And again, if anybody did have a question that we were not able to get to, we will get to them individually after the event. Thank you, ladies, so much. Have a great rest of the day.
Thank you.
An amazing panel.